If you have cancer or someone you know has cancer, whether it's an adult or a child, this video will be of interest to you. It explains how cancer occurs in the body and how a person's diet might influence the rate of cancer growth. In addition, I propose how restricting the consumption of grains could lead to less medication side effects and late effects. This hypothesis has not yet been tested in clinical trials and is not meant to replace treatment advice of your doctors. Glucose restriction to complement cancer treatment. Cause of cancer in children versus adults. It is intriguing to learn that the average age of a child with cancer is 6 years, while the average age of an adult cancer patient is over 60 years. This suggests that something is different about the cause of childhood cancer compared to that in adults. I propose that cancer in children results when a stem cell in the fetus undergoes a developmental anomaly such as a malfunctioning of the cell's power generation facility called the mitochondrion. Another cause could be that a stem cell gets functionally isolated from cells in the neighborhood. Either way, this stem cell is a cancer cell in waiting in the child's brain, bone marrow, or in an organ. At some point later in the child's early life, the cell responds to a signal to multiply, but it cannot stop. When this happens, it becomes an active cancer cell. In adults, a stem cell starts accumulating mutations in nuclear genes from exposure to external or internal agents. At some point, mutations affect both copies of the gene, one from the mother and from the father, that tells the cell when to stop multiplying. This cell now is a cancer cell in waiting. Later, it responds to a signal to multiply, but it cannot stop. When this happens, it becomes an active cancer cell. The role of glucose in cancer cell multiplication. In both children and adults, in addition to a signal to start the process of multiplication, as mentioned above, a cell needs two other items to multiply. One, a fuel source to generate enough energy to multiply, and two, the biological ingredients to fabricate the new cells. Scientists know that glucose is a vital source of both the energy and the ingredients used to construct new cells during cancer cell multiplication. In children as well as in adults, cancer cells voraciously confiscate glucose from their environment. Cancer cells appear to be very efficient in using the glucose. They use a small portion of each glucose molecule for energy extraction and use the rest of the molecule to fabricate the materials needed to construct new cells. This capability is most likely an inheritance from the cells that originally appeared on Earth. To survive and multiply, they could use only a small amount of energy from the glucose they absorbed from the environment, because those earliest cells did not contain mitochondria where modern cells produce energy proficiently. The immune system in cancer. The human body has evolved to have many biological mechanisms to fight cancer cells. It has the ability to repair mutated genes. If that doesn't work, dysfunctional cells are programmed to self-destruct. If that doesn't work, the immune system has killer cells that can seek out and destroy cancer cells. With all these mechanisms to fight cancer cells, it raises the question, how does anyone get cancer? What goes wrong that our sturdy immune system cannot prevent most cancers from occurring? Anti-cancer mechanisms competing against glucose-stimulated cell proliferation. I suggest that the reason humans are experiencing an increasing incidence of cancer worldwide is that cancer cells are multiplying at a faster rate than our immune system can eliminate them. But why would this be occurring? In my view, our immune system cannot keep up with the growth of cancer cells because of the abundance of glucose in our modern diet full of grains and grain flour products. In nearly every nation of the world, the diet is increasingly composed of grains, wheat, oats, rice, corn, and other grains. A person with cancer who eats a slice of pizza, bagel, toast, flatbread, roll, spaghetti, donut, muffin, cake, pie, cereal, or rice is effectively providing glucose the cancer cells crave. 2 ways a low-carb diet can help cancer patients. There are 2 ways that reducing the consumption of grains and grain flour products can help cancer patients. The first is obvious. A low-carb diet restricts the availability of glucose to cancer cells. This can slow the growth of cancer cells and possibly keep them from metastasizing, moving into other parts of the body from their site of origin. The second way that a low-carb diet can help is equally important, and it has to do with treatment. One of the major problems of cancer treatments such as chemotherapy, radiation, and immunotherapy is that the cancer cells can become resistant. This often prompts doctors to use higher doses of medications, hoping to control the cancer. However, this can lead to even greater resistance and more side effects. If, on the other hand, the patient can contain the growth of cancer through diet, it could help doctors avoid using higher dosages of medications, or at least use a smaller increase of dosage, which would lower the potential for side effects. Furthermore, an additional potential benefit of a low-carb diet is that by lowering the dosages of medications, it can lessen the potential for the side effects that cancer patients often incur years later. For example, there are about 400,000 adults in the United States who are childhood cancer survivors, many of whom experience late effects such as memory problems, infertility, heart failure, and secondary cancers. The objective of this treatment plan is to minimize the immediate and later side effects by using the least amount of cancer treatment possible. I believe that by reducing the amount of glucose available to cancer cells by reducing the consumption of grains and grain flour-based foods to less than half of what is consumed in the present-day diet, we can theoretically achieve the objective. For example, for breakfast, one could have coffee with or without milk and sugar, about 3 or 4 tablespoons of oatmeal or another cereal mixed with 1 tablespoon of raisins or another dried fruit, plus a tablespoon of nuts. For lunch, one could have a carrot and cucumber salad, a serving of cooked vegetables and a few stuffed mushrooms, a piece of chicken and a few slices of fruit along with a glass of water. For a snack, one could have a cup of tea with milk and sugar, a small piece of cake made without grain flour and a few nuts. For dinner, one could have a small plate of lettuce with some tomatoes, a piece of fish, 2 different cooked vegetables such as broccoli and beans, and some dried fruits with a glass of water. You are free to make appropriate substitutions for each of the items mentioned. The only absolute requirement is reducing or eliminating the amount of grain or grain flour-based foods consumed. This concept is not unlike what occurs when people continue to live comfortably with some tumors. Another example is 1.5 billion people globally living with parasitic infections in their intestines and experiencing no symptoms. This even opens up the possibility of surviving with cancer by slowing down the rate of multiplication of cancer cells significantly. This is similar to the state of remission after treatment when cancer cells are still in the body but undetectable. The above conditions are possible because our immune system is trained to accommodate an abnormal growth or potentially injurious agents in the body as long as they don't misbehave, reinforcing the immune system to prolong survival. To fully realize this goal of prolonged survival by slowing the rate of cancer cell multiplication, regardless of the age of the patient, the body must satisfy 2 conditions. 1, it must be able to transport immune surveillance cells to the areas where cancer is threatening to grow or invade. And 2, it must have a robust immune system to detect increased cancer cell division and control it. Both of these conditions are achieved only through the maintenance of good general health and well-being through exercise and good nutrition as promoted by the American Cancer Society. To achieve these conditions, I recommend not only reduced intake of grains and grain-based food items, but also eating a wide variety of vegetables and fruits supplemented with herbs, spices, nuts, and mushrooms, with or without non-vegetarian items to provide all nutrients the body needs in a timely fashion. It is my hope that the more the parents of a child with cancer or you as a patient understand cancer, the more control you have to determine the final outcome. Although there is never any guarantee with cancer, the ideas presented in this video may be effective to some degree. If necessary, you can always resume aggressive cancer treatment, but the strategy in this video to use dietary change to starve cancer cells and lower the dosages of medications may help to avoid both immediate and later side effects. This can improve your quality of life for years to come.